The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.
Consider This, a program of issues and information behind today's news. Once again, from the campus of the University of Nebraska at Omaha, here is your host, Kathy Wyatt.
What do Vincent van Gogh, Sir Isaac Newton, Neil Young, Agatha Christie, Charles Dickens, and Danny Glover have in common? Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. The answer, epilepsy. Joining us to talk more about this neurological condition today are Dr. Sanjay Singh, epileptologist and director of the Epilepsy Center at the Nebraska Medical Center. He is leader in the field of epilepsy. Next to him, Mary Overton. Mary is the co-founder of the Omaha Epilepsy Support Group and the mother of our next guest, Heather Overton. A 25-year-old, she was diagnosed with epilepsy at just 18 months of age. Thank you all for joining us and welcome to the show.
Thanks for having us.
Thank you.
Dr. Singh, let's start with you. Just what is epilepsy?
So epilepsy is a disorder of the brain. Your brain cells talk to one another by electrical discharges. And when you have an abnormal electrical discharge, that is what a seizure is. So it's like a mini electrical storm in your brain. And how it presents depends upon where in your brain this electrical storm happens. So it affects the part of your brain called the cortex, which is the part that makes you uniquely human. It's the top part of your brain. And so if it affects, say, your motor control center of your brain, you have convulsions. So you shake and you have motor seizures. If it affects the sensory control part of your brain, then you just become numb or tingly in one side of your body. If it affects, say, the visual area, a person can actually see movies in one half of their vision fields, which they know do not exist but is happening as part of a seizure. So it can be varied depending upon where in the brain it happens. But it is electrical storm is the best way to understand it in your brain.
Wow, and we do have a graphic that's available to talk specifically about the different types of seizures, and you went over there, but you have names for them, and we have that up if you could talk briefly about those.
So the generalized seizures, there are two major types of seizures, generalized and partial, the first two that you see on your graphic. Generalized are ones where the electrical storm affects the whole brain simultaneously. So you have an electrical storm that affects the whole brain. Partial seizures, as the name suggests, affects a part of the brain. So if it affects one lobe or part of one lobe, that's what a partial seizure is. And the partial seizure is divided into simple partial and complex partial, the lower two lines of your graphic there. Simple partial is when people have a partial seizure, but they do not have any alteration in consciousness. So they could be having jerking of their left hand, but they are actually able to talk to you and they're fully conscious. Complex partial is any alteration in consciousness. So if someone, say, has a blank stare, then and is not responsive fully, but is not totally unconscious, that qualifies as complex partial seizures. Partial seizures are much more common than generalized seizures. Generalized seizures are about 20-30% of the total number of seizures. About 70% of seizures are partial seizures. And the commonest kind of partial seizure is the temporal lobe seizure. So that affects the temporal lobe, which is here in the temple area of your brain. And that is the commonest kind of seizure that exists. Most people associate seizures as convulsions, but the commonest kind of seizure, the temporal lobe seizure, that is not a convulsion. That is just a blank stare for about a minute, and then the person is out of it. And so it's often misdiagnosed as people not paying attention, people having anxiety disorders, because it can be preceded by anxiety. And people can smack their lips a little bit with that blank stare, and they can actually rub their hands some. So that is the blank stare, the lip smacking, and the hand rubbing, that or just the blank stare alone. That's the commonest kind of seizure that exists.
And no one is immune to this. Talk to us about who's at risk and what we're talking about numbers-wise, especially in Nebraska.
Sure. So across the country, about 3.2 to 3.5 million people have epilepsy. In the state of Nebraska, our estimate is about 20 to 25,000 people have seizures and epilepsy. 1 out of every 100 people will have seizures and epilepsy, so it's not an uncommon condition. Who gets it? No one is immune to it. Everyone, as you said, can have seizures. People can have seizures during their childhood, during their young adulthood, and then as they get older. There's a common misperception out there that seizures actually begin mostly in children. And now the elderly have actually taken over from children as the group that has the most nuanced seizures. So in people over the age of 65 will have more seizures than children under the age of 15.
And Heather, you know all too well what Dr. Singh is talking about. 25, you were diagnosed at the age of 18 months.
Right.
Walk us through your journey for us.
Well, when I was a baby, I don't remember much, but I was 18 months and I was diagnosed with febrile seizures, or epilepsy, excuse me. And then those progressed into the absence seizures, the staring spells that Dr. Singh mentioned. I outgrew those by the time I was 9. They stopped the medication. Then I was good, I was okay, didn't have any seizures until I was 13. And then I was in high school and doing the keyboarding class, and I was just having these weird jerks and I didn't know what was going on. So I hid it from my parents for, I don't know, a month, maybe 2 months. I don't know how long it was, I don't remember. And finally I went home and I was like, something's going on. I don't know what it is. And they weren't really sure either, because the staring, the absence seizures and the myoclonic jerks that I had been diagnosed with, that was totally different. So, but when I finally went to the doctor and was told I was diagnosed with JME, juvenile myoclonic epilepsy, that was devastating. The myoclonic jerks went into the tonic-clonic seizures. What everybody thinks when they think of a seizure, they think of the convulsions. The jerks progressed into that, and I had those more and more as I got older. It seemed like the myoclonic jerks went away, and I just had the tonic-clonics. But and then when I was, finally 19, 20, Dr. Singh came and they started the epilepsy center, and he got me seizure-free. So he's my hero.
Pretty scary stuff, though. I mean, to hear you talk about it is, obviously jolting. For people who've not experienced seizures at all, walk us through what is that? Tell us what it's like to go through that.
What it's like. The seizure itself.
Yeah.
The seizure itself is very draining, especially the tonic-clonic seizures. They take everything. You apparently use like every muscle in your body, and so it's just draining, and it's emotionally draining. And so after I would have a seizure, I would sleep the entire day until the next day. And I was having 3 to 4 of those a week in high school. And so that was a lot. I mean, in high school, it was hard to keep up on work, grades, or schoolwork. But I mean, as far as anything else, I don't know how to describe.
Mary, you obviously, watched her go through all of this. Mom, caregiver, advocate. Talk to us from a mother's perspective.
It's scary to see your child have epilepsy and have their first grand mal seizure. Was devastating. My husband and I were in denial for a while, and then when we realized that this is what she had, trying to support her in every aspect. And when she would have her grand mal seizure, it literally drained her. she was exhausted. She would sleep for hours on end, and to know what she was going through was hard. And as a parent, we had gone from, started off with one doctor, and each one would say, well, this is as good as she's going to get. Well, as a parent, this is not as good as she's going to get. And we went from doctor to doctor to doctor, and Dr. Singh was doctor number 9 on our list. And I was just one of those parents that I did not give up on my child. And we never let Heather give up on herself. 2 words in our house she was never allowed to use is I can't and I won't. And it's because just because she had epilepsy, she could do anything she wanted to do. She played sports, she worked. We let her do anything she wanted to do. I mean, naturally not being able to climb a ladder without one of us there, but we never held her back. We always let her know, you can do what you want to do, and this does not stop you from doing it. But as a parent, getting her the help and not taking one word from a physician telling me that she's not going to get any better, that just didn't satisfy me enough. I guess my husband and I were so determined that we were going to search and search and search, and we did. Dr. Singh came into our lives, and he is our hero. And without him, I never thought there'd be a day where Heather would be seizure-free.
Well, and certainly there at every turn for your daughter.
Yes.
And as I understand it, you and your daughter have now made this quite the mission, and in fact have started your very own support group.
Yes.
Where you are helping others as well. Heather, tell us about your role in that support group.
I'm a co-founder. My mom's really the backer. She really needed somebody to talk to. I never knew anybody like myself until we had that support group, so I really needed that as well. I didn't know I needed it until we had it. But she was the one that really went to Dr. Singh and said, hey, we need this here in Nebraska. And then once we got it, I was right behind her. But it's great to have other people, I think not only with epilepsy, but any condition, anything where you can go sit and have that commonality and, learn, just talk about, this is what I'm going through, you know what I mean? And just, it's nice to have that, once a month be able to talk.
And Mary, as I understand it, there are really 2 core support groups in the state. There's Omaha and Lincoln.
Correct.
You were obviously inspired to take the initiative to get this done. Talk to the people who are watching across the state who may want to put something like this together in their own community. What did it really take on your part to get this done?
The reason I was so determined when I talked to Dr. Singh was when Heather was little, I mean, your family's a great support system, but you really need another parent to talk to. I don't care if it was 2 o'clock in the morning when I would be so upset, I'd had a bad day, and not have that. And every doctor that we'd had for her would never let me connect with another family, and that was so frustrating to me. And so when I approached Dr. Singh about wanting to do this, my reason was because I want other parents to know that there's somebody there for them 24 hours a day for them. And so with Dr. Singh's help, we approached the Nebraska Medical Center about holding a support group. They backed us up 100%. And with the help of Michelle, who has started a support group in Lincoln, and Laura, who also helped us out, we made up our own brochure, got the approval of the Epilepsy Foundation out of Maryland on, I'm correct on that, with Maryland, and to use their logo. And we made up the brochure, and we distributed that to all the neurologists in the Omaha, Iowa area. And it is open to those with epilepsy, their family members, their friends, anyone who wants to come and have that support. And it's nice to be able to know that somebody else is there. And like Heather said, she thought she was the only one that had epilepsy. And when she walked into our first meeting and the room was full and realized she wasn't alone. And the ones that come to this meeting just really have no one else to talk to. And realizing that they're not alone. And even though they all may have different types of epilepsy, they're there for each other. And it's a great support group.
Wonderful. And as they are providing the emotional support, Dr. Singh, you're obviously on the other side providing all of the medical know-how. Where are we right now in the way of treatments, and where are we headed?
That's a very good question. Let me say that about 15 years ago, we only had 4 drugs to treat this condition. 4 and maybe plus minus 1 or 2. In the last 10 to 15 years, there has been a complete revolution in therapy for this particular condition. So now we have more than 15 new drugs to treat epilepsy. We have at least 10 more new drugs that are on the anvil that should be available to us to treat patients within the next 5 to 10 years. So almost every year you're getting a new medication. That's what's happening now. Prior to 10, 15 years ago, you didn't have any. You just had 4 that probably 1 every other decade was what we were getting. Now, about 60% of people will respond to medications, but that still leaves about 40% of patients who will not respond to medications. And for those patients, there are other options. One option is epilepsy surgery. And again, that has become much more readily available, and it has become much more accepted with better technology now. So what do I mean by epilepsy surgery? In partial seizure patients are the ones that are candidates for epilepsy surgery. If you can identify where in the brain a seizure is coming from, and if you can make sure that that area is not responsible for any vital functions, we can cut that region of the brain out, and that can cure that person, or at least significantly decrease the amount of seizures that they have. So, as I said before, the commonest kind of epilepsy is temporal lobe epilepsy. In those kinds of patients, approximately 100 to 200,000 such patients require surgery today in the United States of America. All epilepsy centers combined probably do about 3,000 to 4,000 surgeries a year. So you can imagine the backlog that we have. In these patients, almost 60, if not 70% of these patients can become seizure-free after surgery. And this has been proven by very good studies that have been published in major scientific journals. So surgery is certainly an option. If they don't respond to surgery, there is a third option that's FDA approved, which is called the vagal nerve stimulator, where they put a pacemaker here in your chest and take a lead into the vagus nerve in the neck, and it kind of buzzes for about 30 seconds every 5 minutes or so, and that helps decrease seizures too. So that's FDA approved. These are the standard of practice approved options for treating epilepsy, and they help a vast majority. But there are still about 10 to 15% of patients who do not respond to any of these therapies. And that's where we are putting our heads together and trying to come up with new treatment options. One of the newer treatment options that is still being studied is what is a deep brain stimulator. So what we do is we'll take a stimulator, put it in the depths of the brain, stimulate a region that will help alleviate the seizures. People might have heard about this deep brain stimulator in Parkinson's, where the tremors go away when you turn it on, but it's now also being used in epilepsy. We've done some studies at our center that we have presented nationally. There are others where there's a device which is still under study, where a computer actually picks up brain waves from the region of the brain giving rise to seizures, and the computer decides that a seizure is coming on, and it kind of shocks that region of the brain and stops the seizure from happening. So it's like an implanted device within the brain or the cranial cavity of the person. Another one, other studies are looking at seizure prediction. So if you could predict seizures, say 15 minutes or half an hour in advance, and then you could either institute some therapy or give them a drug or do something to stop those seizures from happening. So that's where a lot of research is happening. There are other avenues where gamma knife is being used instead of actual surgery. You can burn that tissue, and so that's somewhat less invasive than actual surgery. And then other techniques are being looked at where we prevent seizures from coming on or prevent brain cell damage from seizures so that that does not happen. So those are some of the newer options. One of the newer options in evaluation of patients with seizures is what's called an MEG or a MEG scan. And that's one of the latest, greatest things in brain evaluation today. We do a test called an EEG, which looks at electrical activity of the brain. And in high school physics, they teach us that if there is an electrical current going in one direction, you have the right-hand rule, which has magnetic fields around it. So if we are picking up electrical activity from the brain, which we've been doing for the last 75 to 80 years, it should have occurred to us that we should try and pick up the magnetic activity of brain cells too. But being doctors, one of the reasons you are a doctor is because you're not good at maths and physics. Otherwise, you'd be engineers. So when we finally pick up these things, they've developed a machine called a MEG scan, and it is a very accurate test. It's probably the most accurate test of the functioning of the brain. And so it's so accurate that if you move your index finger, it'll tell you exactly where in the brain with millimeter accuracy as to where it came from. So it is now approved for, before you do any neurosurgery in areas of the brain that control movement or sensation or vision, it is essential, or it is advisable to do this test before so the neurosurgeon knows not to cut in that region. But it's also a godsend for epilepsy because it looks at all abnormal activity with great sensitivity. And so these are some of the most recent advances in the field.
Certainly encouraging news. And I understand that you have partnered with Heather to create and develop some more encouraging hope for folks, and that is a video. Heather, if you would talk to us a little bit about the Triumph Over Epilepsy.
Right.
Yeah.
A few years ago, actually here, we shot the video Triumph Over Epilepsy. The Nebraska Medical Center had asked me to participate in that video, and it is an inspirational video that is used to they use for other people, but
A 6-minute piece from what I
it's 6
understand.
minutes, and they can get it, or it's on the Nebraska Medical Center's website. If you go to Neurological Sciences, it's right there. It's on a laptop. My picture's right there. Click on it and it should go.
And people can certainly, we've been putting up information throughout the show, they can certainly call a number or kick an email and obtain a copy of that video for their own use at home too. So, and I understand too, Heather, that kind of in cooperation with that, you do a lot of public speaking.
I do.
Not only here in the area, but you're kind of famous. You're talking across the country. Tell us about those speaking engagements and what your take-home message really is to people.
I am an epilepsy advocate. I go around the country and tell my story, 25-minute story, and it's a great experience. My basic message is just to never lose hope. I've been 20 years before I was seizure-free, and my parents taught me to never give up. So basically, don't ever give up. Find an epileptologist that works for you, and don't settle. And that would be basically my story. Just be your own biggest advocate.
Thank you very much. And Mary, you know, as a mother, watching all of this, as you talked earlier about how difficult that was, there are going to be people watching who are just beginning their journey as a parent. Talk to us, give us some words of hope and encouragement from a parent/caregiver perspective.
Don't give up. That is my biggest message that I tell everyone. Don't ever give up. Don't ever, if one neurologist tells you there's no hope, move on to another one. And I truly believe that. There is hope out there, just like Heather said. There are so many physicians there, neurologists, epileptologists there, that can help. And my biggest thing is just be there for as a parent, be there for your child. If you cry a lot, if you scream a lot, if you vent a lot, that's all normal. I had one mom that called and said, all I do is cry a lot. That's normal. Don't ever be ashamed of your feelings, and don't ever be ashamed to question the doctor. You know, why are you doing this? I don't understand. She's there, you know, he or she is not getting any better. Just do not give up as a parent. That is my biggest message. Don't ever give up, and let your child be normal. Let them do everyday things. Don't hold them back. That is my biggest thing. Don't ever hold them back.
And Dr. Singh, from a medical perspective, you know, we've heard a great deal about selecting that right physician. We just have a very short amount of time left. What are we looking for when we make that call to do some inquiring?
So, epilepsy and seizures, the first doctor you see is your primary care doctor. And in some of these cases, they are good doctors to see, and they can treat these patients. If they cannot treat them, they usually refer you, or you can go to a neurologist. And we have great neurologists in the state of Nebraska. Unfortunately, a lot of them are here in Omaha and in the Lincoln area, and we don't have that many in the other parts of the state. But at least where the resources exist, they are there. I mean, at our center, we have approximately 4,000 patients of epilepsy that we treat. They come from all over the state and surrounding areas. And so if your neurologist is not able to handle the case, or if you're looking for other resources, then you get referred to an epilepsy doctor like myself, or to our center. We also realize that we cannot see all the patients in Nebraska and Western Iowa, so we actually go out and pass on some of this information to our colleagues, other healthcare providers in the state. And so I've personally been out from Scottsbluff to Kearney, Grand Island, Lincoln, Omaha, Norfolk, Yankton, South Dakota, and all over Western Iowa. And we share the new information with our healthcare providers, because a lot of them are treating epilepsy, and then they can use this information to provide better care.
Right, and speaking of that, we do have some information that we want to pass on to folks. The show's been all about offering hope and help. So we have those there, and we wanted to make sure to give ample time for people to see those. The Epilepsy Foundation, there is the website there, www.epilepsyfoundation.org, and of course the Nebraska Medical Center, always a great deal of help to folks, www.nebraskamed.com. November, of course, Epilepsy Awareness Month, but like anything else, we should be talking about this all the time. To my guests, a very sincere thanks. To you at home for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours.
The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.